Symax-Sr is used to treat a variety of stomach and intestinal problems such as cramps and irritable bowel syndrome. It is also used to treat bladder and bowel control problems, cramping pain caused by kidney stones and gallstones, and Parkinson's disease. Additionally, it is used to decrease side effects of certain medications and insecticides. This medication works by decreasing acid production in the stomach, slowing down the natural movements of the gut, and relaxing muscles in many organs. It also lessens the amount of certain body fluids like saliva and sweat. Symax-Sr belongs to a class of drugs known as anticholinergics/antispasmodics. The recommended dosage and timing for Symax-Sr should be determined by a healthcare professional. When taking Symax-Sr, you should follow your doctor's instructions and take it by mouth every 12 hours. You should swallow the extended-release capsules whole and not crush or chew them, as this can cause side effects. The dosage will depend on your medical condition and how you respond to the treatment, so do not increase your dose without consulting your doctor. Adults and children 12 years and older should not take more than 1.5 mg in 24 hours. It's important to note that antacids may interfere with the absorption of this medication, so it's best to talk to your doctor or pharmacist for more information. Make sure to drink plenty of fluids unless directed otherwise by your doctor, and let your doctor know if your condition lasts or gets worse. Some common side effects of Symax-Sr may include dizziness, drowsiness, blurred vision, dry mouth, headache, trouble sleeping, constipation, flushing, dry skin, and decreased sweating. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. It's also possible that you may notice an empty medication shell in your stool, but this is harmless. Remember that your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as mental or mood changes, fast or irregular heartbeat, difficulty urinating, decreased sexual ability, loss of coordination, trouble speaking, or vomiting. Seek immediate medical help if you experience very serious side effects, including eye pain, swelling or redness, vision changes, or symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And as always, if you have any concerns about side effects, don't hesitate to reach out to your healthcare provider. Before taking Symax-Sr, make sure to let your doctor or pharmacist know if you have any allergies to hyoscyamine or atropine. Also, inform them about your medical history, especially if you have any eye problems, urinary issues, stomach/intestinal problems, thyroid issues, heart problems, high blood pressure, kidney disease, heartburn, nervous system problems, or myasthenia gravis. If you wear contact lenses, you may need to use wetting eye drops because Symax-Sr can cause dry eyes. This medication may cause dizziness or drowsiness, so be cautious when driving or using machinery. Avoid alcohol or marijuana, which can increase these effects. Before undergoing surgery, inform your doctor or dentist about all the medications you are currently using. Be cautious in hot weather or during strenuous activities, as this drug may increase the risk of heatstroke by decreasing sweating. Older adults and children may be more sensitive to the side effects of Symax-Sr. If you are pregnant, use Symax-Sr only when clearly needed and consult with your doctor about the risks and benefits. This drug also passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that may change how Symax-Sr works or increase the risk of serious side effects. Keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Symax-Sr include certain antifungal drugs, bisphosphonate drugs, corticosteroids, digoxin, potassium tablets/capsules, and pramlintide. Additionally, let your doctor or pharmacist know if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Keep in mind that Symax-Sr may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this medication. If you or someone else has taken too much Symax-Sr and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include hot and dry skin, fever, unusual excitement, fast or irregular heartbeat, and seizures. It is important not to share this medication with others. In addition to taking Symax-Sr, managing digestive disorders may also involve making lifestyle changes such as participating in stress reduction programs, engaging in regular exercise, quitting smoking, and making dietary changes to enhance the effectiveness of the medication. It is recommended to consult with your doctor or pharmacist about lifestyle changes that may be beneficial for you. If you forget to take a dose of Symax-Sr, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store Symax-Sr at room temperature, away from light and moisture. Make sure to keep it in a safe place, away from children and pets. When it comes to getting rid of any leftover medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.